All right.
So, welcome to this interview. I'm thrilled to have my colleague and co-lead of the Health and Wellness Coaching Community of Practice with me today, Dr. Michael Arloski. And Dr. Arloski is founder and CEO of Real Balance Global Wellness Services. He and his company have trained thousands of health and wellness coaches over a number of years, and it's an ICF approved training provider. He is a psychologist, a coach, and a veteran of the field of wellness for decades, I think at this stage it's fair to say. And I'm proud to call you a colleague. So I'd love to start this interview by I guess sharing, many people refer to you as the father of wellness coaching. You've written books on the subject, and you started off before there was such a field. So how did you begin combining life coaching with helping people make lifestyle changes?
Yeah, well, thank you, Rachel. I appreciate you interviewing me here for the community of practice. You know, the connection really seems so natural and so obvious to me. I've been in the field of wellness, like you said, for decades, for many years. And in 1996, I began being trained in life coaching. And I just saw it as a perfect fit because everything I knew about the field of wellness was mostly that we were trying to help people improve their lifestyle by giving them education and opportunity, trying to work with groups of people to improve norms, all kinds of strategies like that. And it was working to a certain degree, but when it really came down to individuals succeeding at losing weight, quitting smoking, getting better sleep, managing their stress, all these specific things, many people weren't succeeding. And as a psychologist, I saw it as, they're really struggling to change behavior. And how can we really help them? Well, maybe by providing them with a coaching ally, right? And a coaching methodology that's based, on how do people really succeed at behavioral change. So I started teaching some classes with my dear friend Pat Williams and his organization, Institute for Life Coach Training, and quickly realized that, I was really onto something here. I'd already began making presentations at the National Wellness Conference and places like that, and really started to find that there were a lot of people who had been working with people individually and thinking they were doing coaching, but they weren't really applying what you and I and people that have been trained by programs in the ICF approval, territory would call it coaching. They would probably call it consulting, education, and so forth. So my real aim was to bring in the ICF core competencies, the real skills of life coaching, and really apply it to helping people improve their lifestyle. And that's really what took off.
It sure has taken off, though. How many people your business has trained over 6,000 coaches, hasn't it?
Yeah, all around the world. Yeah, it's been extremely rewarding.
Yeah. So I guess what would be helpful is that you've been involved in this field since the 70s, as you said. What is it that is important for health and wellness coaches to understand about wellness and about what the field of health promotion has to offer?
Yeah, there's a whole field of health promotion and wellness, a whole professional or, field of study and pursuit that has been doing research, has been doing many applied programs, much of it in corporations that have worksite wellness programs, in universities, hospitals, all kinds of places. And we have learned a lot about how people change health behavior. And if you're a health and wellness coach, you need to know about this. Some health and wellness coaches get, pretty limited training, unfortunately. And they need to kind of expand their horizons and realize there's this entire field out there that has a wealth of knowledge, journals and research and conferences and, conferences like the National Wellness Conference, the Art and Science of Health Promotion Conference put out by the American Journal of Health Promotion, and others like that are really valuable sources of knowledge, professional networking, and kind of things we need to know. When it comes to helping people change behavior, individuals don't do it in isolation. We're all part of groups, we're all part of families, we're all part of workforce situations. And there's a lot that we know now about peer health norms, how that influences health behavior and choices, the environment that we work in, that we live in. And the nice thing about the field of wellness is that it looks at all of it. And the other thing to understand is that it's different than just medicine. We have a lot of coaches we train who start out thinking they know what wellness is, and what they know about is holistic health. And holistic health is sometimes includes wellness, but a lot of it is just simply an alternative remedial treatment. And that's not what we're talking about here. So they need to broaden their understanding, and they can benefit from it, and their clients will benefit too.
Yeah, it's that for getting those blinkers off and expanding the horizons, isn't it? Mm-hmm. Never-ending journey.
There's too much professional siloing, and we need to just kind of, like you said, look at our peripheral vision.
Absolutely, absolutely. Which I guess your next book is about, or certainly has that energy about it. It's about the craft of health and wellness coaching. So share a little bit about what you have in store for us with that book.
Yeah, my aim is to really get that out this year. And I'm tentatively calling it something like Advancing the Craft of Wellness and Health Coaching. And, with any field, we need a lot of great research to create a foundation so we know we're on the right track. And unfortunately, I think what starts to happen, especially in our evidence-based world that we're in now, is we start to think, unless there's a peer-reviewed journal article about every tiny little word that comes out of our mouth, we can't say it. And what happens in all fields, like I did therapy with people for like over 27 years. I'm a psychologist. I was trained very heavily in a lot of different methods. And, I realized that doing psychotherapy, yeah, sure, we look at research, we look at the underpinnings, we look at theoretical foundations. But when you're actually sitting there with a real live person, it's one part art and science. We always say art and science, and we forget about the art. We just focus in on the science. I mean, you can go to a conference called that, and about 7/8 of the presentations will be about the science. We really have to emphasize the art. We really have to emphasize how we work with people and all the subtleties of it. And that's what I'm doing in this book, is really giving people some really specific ways that they can speak and interact with their client at a more masterful level. We always talk about the ICF core competencies, and we start to get the idea, all I have to do is be competent. Well, I often say, would you like to go to a dentist who is just competent? Or would you like to go to a dentist who is proficient or even masterful? One of the things you see at an ICF conference sometimes is masterful coaches doing demos, right?
Yes.
And when you see it, you're kind of like, wow, how'd they do that? And that's what I'm talking about. How do you get to that higher, better level? One of the real tragedies right now in health and wellness coach training is that people think health and wellness coach training is a one and done. that is, okay, I took real balance training, I'm done. I took well coaches training, I'm done. No. Continuing education, come on, grow like you would in any other profession. When you were trained as a pharmacist, did you just say, okay, I know my chemistry, I can go out and work with people now, I'm done?
Yeah. I think it's one of those things, isn't it, that's about being a professional, is
Yeah,
about continuing to grow and develop. And really, whatever the qualification is that you get, it's a starting point, not an end point.
exactly. Exactly. I served on the International Consortium for Health and Wellness Coaching, one of the founding members of that. And I was the leader of establishing our committee on, a code of ethics that we worked with in cooperation with the ICF and their code of ethics. And one of the things you see in a good code of ethics is you have an ethical obligation to continually grow in your profession, for the safety and benefit of your clients.
Yeah, it's one of those ones for in pharmacy, we talk about the health, well-being, care and safety of the patient in pharmacy language, but it's the client. And that is a responsibility we have, isn't it? And it's not
Absolutely.
one to take lightly. It's not. We're talking
Mhm.
about people's lives.
Yeah. So what I really want to get at is how can I help, coaches get even better at what they do,
Yeah.
get into it in a way where they can be so adept at the basics that, it's kind of like a fantastic musician who, has played the scale so many times, they can hit any note they want anytime they want to hit it, right? And I want to see a coach be able to do that, where they're not having to work at thinking, well, geez, what should I do now? They will know, and getting to that point, that's what I'm talking about, developing yourself as a craftsperson.
Wow. And Michael, that kind of leads in very nicely into what is your deepest desires with regard to what we could achieve together in this health and wellness coaching community of practice.
Yeah, well, I was very, very pleased when the ICF invited us to kind of climb on board and create a community of practice on this topic of health and wellness coaching. I think it's probably the biggest growing area of the coaching field today. And when we've got this opportunity, what you and I have really talked about is how can we share some of the best knowledge out there, have some of the best guests possible, some real leaders in the field from many different perspectives, and we've done that already over the course of the last year. And then also have a place where people can interact and contribute questions, ideas, conversation about, how can we take the field forward? How can we also learn more about it, each one of us? And, ICF has kind of given us a platform to do that and enabled us to reach people all around the globe. Yourself there in Ireland is one example.
Yeah, well, I think there's 60% of our members are from the US and 40% are global,
Mm-hmm.
which it ties in with your company, really, doesn't it? It's like Real Balance Global Wellness Services. And I've met you in Ireland, so providing global services in Ireland. So tell us a little bit more about growing the field internationally.
Yeah, I really see in the field of wellness the international arena being a huge area of growth. People all around the world are wanting to have more than just spa products and stuff like that and call it wellness. They're really looking at, okay, how can we help the population health problems that we have? For example, in China, the diabetes rate is astounding. In the United States, we have 11.6% of the population diagnosed with diabetes. In China, they have 11.5. And that's 11.5% of 1.4 billion people. So do they have a population health problem? And is that problem related to behavior? Well, they call diabetes a lifestyle disease for a reason. And that's just diabetes. 51% of the men in China smoke. Over 50% of the doctors in China smoke. How scary is that? So yes, they're looking for ways to help people succeed at changing lifestyle behavior. So we've been working there. I've been to China like 3 times already, doing training and working with a large employee assistance program there to deliver that. We've also been, for years now, having a presence there in Ireland with the Institute for Health Sciences. We have a couple of their faculty teaching classes for us now. We've had a presence in Brazil for many years, Australia, and also now just starting to explore how we can bring health and wellness coaching to the Philippines. So, there's a lot of things happening. And we've also trained individual coaches in many different countries, kind of here and there around the globe, from Hong Kong to Dubai to you name it. So it's the interest is really there. They really see the need. When the World Health Organization in 2003 said that the #1 killer now is not infectious disease, it's non-communicable disease. It's what they've termed lifestyle disease. That was a big wake-up call. And what we've been trying to do is see how health and wellness coaching fits into lifestyle medicine. I've been very involved in that field for a good while, presenting at conferences in both United States and the Philippines on lifestyle medicine, because we provide the behavioral component of change. The medical world can provide treatment, they can provide education, but for the most part, they're not involved in the behavioral piece. And that's where they're trying to, really kind of catch up.
They are. So I think it would be a really nice, if I say for our final question with you, Michael, if you shared a little bit about what you do as part of your own wellness practices and why those type of practices are actually, I was going to say for all coaches, but to be honest with you, I think, for all of us.
Mm-hmm. Yeah, I think something that can't be overlooked is the credibility you get from practicing wellness yourself, a wellness lifestyle. You don't have to be magazine boy or girl, cover girl type thing. You have to look like that. You just have to be dedicated to your own health and wellness and working on it, whatever that means. And it pays off in many ways. For one thing, it not only gives you credibility, it gives you empathy. You start to understand, changing lifestyle is not all that easy. You kind of get surprised sometimes by some of the things that get in the way in your own point of view, your own beliefs, but also in your own circumstances. So you start to understand what it's like for your clients to change whatever it might be. But the other big benefit, of course, is your own health, your own energy, your own stamina. And also when a health challenge hits, if you've been living a healthy lifestyle, you can fight back and overcome it so much easier than, if that hadn't happened, whatever it might be. So, what I do for my own revitalization, all my life I've been an outdoorsman. And when I connect with the natural world, that's where I get a lot of my personal renewal on both a mental, emotional, physical, and spiritual level. And we have to kind of refresh ourselves that way. We have to nourish ourselves. And also, it shows up in my practices. There's dietary practices that I have that I've been doing for 30 years that really help me. Nothing extreme, but just things that, quite frankly, are, based on science. And, when you go to graduate school, you start paying attention to research, but also just connecting with people, having fun. You know, my wife and I love to dance. We do a really aerobic, Telluride bluegrass style swing dancing. It's really a riot. We have a whole group of friends that do that. And that social connection is probably one of the healthiest things ever. That and, you know, prioritizing family. You know, I've got children and grandchildren, and you know, they're a big part of my life. And, you know, one of the saddest things I ever heard was a really well-known celebrity doctor who introduced herself with all of her accomplishments and all of her accomplishments. She was kind of embarrassed by it. So she kept saying, but of course I don't have a life. And she was almost bragging about that when she was saying it. And I thought, wow, that's really tragic. Um, I don't think we can make that trade-off if we're really going to be healthy and well. Now, it's quite the balancing act, but it really does pay off.
Yeah, well, you've got that lived experience of the payoff. So, Michael, if anybody would like to join, maybe they're listening to this recording and they haven't joined the ICF Health and Wellness Coaching Community of Practice yet, then that's something we'd invite you to do. And there's lots of recordings there. You can register for our future sessions with our experts. And that would be, we'd be more than delighted to have you join us in that community.
Yeah, and some of the programs that we do are with a guest speaker and so forth that makes presentations. But sometimes we also host, you might say, a community roundtable of people just, you know, whoever joins, we can have a great conversation following up on the topics that we've been discussing in those presentations. So it's a real opportunity for you to participate as well as be a passive listener.
Absolutely. So from Michael and Michael Arloski, Rachel Dungan, we are delighted to be your co-hosts for the Health and Wellness Coaching Community of Practice and looking forward to meeting you there.
Thank you very much.